again, everyone, and thank you for joining us for this APF at Home Fireside Chat. We are thrilled to welcome Dr. Adam Leventhal today, a recipient of the newly redesigned APF Gold Medal for Impact in Psychology. I am your host today, that is, I'm Camilla Benbow, and I'm a member of the APA or APF Board of Trustees. As you all surely know, APF is the premier private grant-making foundation in psychology. APF provides over $1 million annually in grants, awards, with increases coming every year, thanks to the generosity of our donors. Our goal is to support psychologists and students using psychology to address major issues and improve lives. APF is unique and it receives the overwhelming majority of its funding, around 95%, from individuals like those of you joining us this afternoon. We cannot express our gratefulness enough to you for your generous investment in APF and the important research we continue to fund. As we proceed through the conversation, if you have any questions for Dr. Leventhal, please feel free to enter them in the Q&A feature found at the bottom of your Zoom screen. We will do our best to address all questions in the conclusion of the program. It is now my immense pleasure to introduce Dr. Adam Leventhal. Adam Leventhal is a professor of preventive medicine and psychology at the University of Southern California Keck School of Medicine and USC Norris Comprehensive Cancer Center. He is an addiction psychologist and a public health scientist. Dr. Leventhal has contributed significantly to the body of research on youth tobacco use and vaping, which has led to policy decisions responsive to an urgent social problem in the form of U.S. Food and Drug Administration decisions to prohibit sales of flavored e-cigarettes products that attract youth. Dr. Leventhal has served as a member of the Tobacco Products Scientific Advisory Committee, which advises the FDA in policy decisions. He also has served on panels of the National Academy of Science, Engineering, and Medicine to guide federal policies directed toward tobacco products and has contributed to the U.S. Surgeon General reports focused on tobacco. Welcome, Dr. Leventhal.
Hi, yeah, great to be here, Camilla.
Great to have you. All right, let's start digging into it.
Okay.
So, Dr. Leventhal, your work is primarily focused on the psychology of addiction. To begin, will you share with us how you came to be so invested in this area of study?
Sure. Yeah, I'm so lucky to study such an interesting topic and actually do science. Hopefully that helps people. So it's really nice when those two things converge. So I think it's interesting if I try to think back about how and why I got into addiction research. I think it was due to the philosophical interest. I was interested in the mind-body connection and, the idea that there's a psychological self and there's a biological self, right? And the fact that you could take an exogenous substance that alters your brain chemistry, and that in turn changes the way you feel, your view of the world. To me, that was always supremely fascinating. And I think that was a critical part of pushing me in to looking into addiction as a focus within the realm of psychology. And that continues to fascinate me to this day about why people use drugs, the fact that drug use is a model of us to understand as psychologists and as scientists, what are the patterns and what is the etiology of paradoxical behavior? Behaviors in which people engage in an action that they know will have a downside, but they do it. And so those are kind of broad strokes reasons, I think, as to why I got into addiction psychology why I've stayed in addiction psychology, and as we'll probably talk about later, you know, the impact of the work has kind of kept me going and fueled towards, you know, continuing in this area.
Interesting. You are the founding director of the USC Health, Emotion, and Addiction Laboratory, HEAL, as well as of the USC Institute for Addiction Science. These two initiatives cover a huge swath of research and transdisciplinary cooperation related to understanding addiction. Could you speak to some of the current areas of focus in the research and education being done within these two spheres?
Yeah, absolutely. Yeah, thanks for asking. It's something we're really proud of at USC. So the Institute for Addiction Science was developed in 2018 here. And the idea was to create a forum and also infrastructure to bring scholars from all different parts of academia, literally cell to society, who are focused on addiction in some way or another, bring them together so that they can collaborate and develop innovative and impactful research programs that's designed to really reduce the prevalence and consequences of addiction in the population. The second aim is to create new interdisciplinary and interprofessional training programs where we bring together folks from all sorts of different viewpoints, whether we're talking about psychologists, policy experts, economists who look at the supply and demand aspects of the drug use problem, sociologists, pharmacists, the list goes on and on. And, you know, we haven't done this yet, but, you know, we're beginning to create new collaborations with cinema and other areas of academia, which still touch on addiction, right? And, you know, can help, I think, us learn about the nature of this problem and how to combat it. So this initiative and this academic unit, we have 80 faculty from 7 different colleges and schools at the university across its 2 campuses, the medical and the university park. And, you know, it's been really exciting to hear really smart people who speak 2 different languages, but want the same end to come together and work together. And so we think that this is a great model. And this is something that this idea of transdisciplinarity, it's not new, right? But I think the field of cancer research and education has been very successful in this approach with the Comprehensive Cancer Center model that's designed to bring together social scientists and population scientists and basic scientists and clinical scientists. You know, there's been a lot of funding that's come in to support these initiatives. Why not addiction, right? We're in the midst of an overdose crisis. You talked earlier about youth vaping. Cannabis legalization is spreading across the country, and the policies are very confusing, I think, to local communities on cannabis, and there's plenty of loopholes. Smoking still continues to be the leading cause of preventable death. And then if you kind of add on to this, other addictive non-substance related behaviors, like, you know, our obsession with digital media and social media and our smartphones, you know, and you can even throw in there addictive eating patterns and its contribution to the obesity epidemic. I mean, I think it's not that much of a stretch to argue that addiction is probably the #1 public health and social problem that we might, you know, want to invest our resources in, and, you know, especially here in psychology as well, as it, you know, psychologists being one of the leading professions to address addiction. There's really a strong rationale for these very large scale initiatives. And so, you know, we use the term addiction science to bring all the ologies together, right? Who have historic roots in their own, academic structures, but often are siloed from one another. Let's bring them together and let's try to really move the needle. So thank you for asking about that. Yeah, it's something we're really excited about. And also for folks, we are launching a Master of Addiction Science, the first of its kind in the nation that applies our approach, accepting applications now for any students or family members of potential students who want to become part of this new wave of addiction scientists who kind of have a very broad lens view on the problem.
Interesting. Oh, well, I think it's very much needed. So I'm glad you're stepping in doing that. I'm thinking about that as being a dean, and now you've given me some ideas.
You got some great addiction researchers at your college. So yeah, just if you want me to come out and do some consulting, happy to tell you what works here at USC.
Sounds like we need to take that conversation offline, but it sounds like a productive one. All right. Well, now, within the large realm of addiction psychology, getting back to our topic, you've had particular interest and clear impact in the prevention of youth tobacco use, especially vaping.
Mm-hmm.
It has included substantial work in advising the FDA on regulation of flavored vaping products and such tangible changes as Juul ceasing sale of certain flavored nicotine. How have the changes brought about by your past research impacted the current state of youth tobacco use and also your current research interests?
Sure. Yeah, it's really interesting. So the reason why this particular research can have such impact, I think, on policies is I will give credit to the kind of structure that was built by the NIH and the Food and Drug Administration to create a new paradigm called tobacco regulatory science. With the Family Prevention and Control Act that President Obama signed in 2009, it gave the FDA authority to regulate tobacco products, commercial tobacco products for the first time. And so as part of the bill, money was earmarked to fund research that can directly inform FDA's actions within what they're allowed to do, right? Which the Tobacco Control Act spells that out, and subsequent rules and regulations have kind of followed in that. And so with that, there's a national network of tobacco regulatory science, tobacco regulatory scientists who are doing this type of work, and it's very different from traditional programmatic research that we are often taught in psychology, where we have a research question and we continue to move forward based on knowledge we learn from one study to the next, to the next, to next. Sometimes it's translational, right? We're trying to move from etiology to treatment. Regulatory science is backwards. So you look at what are the regulations and the types of actions that could actually happen? Mm-hmm. And then what type of evidence is enough to provide the FDA with a strong enough scientific base to say, hey, if we did this new regulation, and you talked about the restriction of flavored e-cigarettes, what would be the impact on the population? And it's really interesting, and it's really gotten me into public health and population health, and thinking about it that way, because the way the Tobacco Control Act is written, and the way this kind of field and the way the FDA regulates in this commercial tobacco products, it's the population as a whole. And so impact to them is, if a regulation or some sort of regulatory action, what is the net effect on the projected total number of lives saved, lives lost, and other potential outcomes of interest that are relevant to public health. So literally, calculating and modeling these types of numbers is, what the FDA needs, right? And so one of the interesting aspects about regulatory science in this, and particularly this field of e-cigarettes, and I'm not the only one who's contributed to this. There's a whole, cadre of researchers nationally, and I was fortunate to be one of several researchers who've helped kind of provide some of the critical evidence in this. But the issue is e-cigarettes. We know we want to keep kids away from e-cigarettes, right? Kids should not be using legal or illegal intoxicants. It's not good for them. On the other hand, you have adults who are addicted to cigarettes are at risk of dying from lung cancer and other diseases. And you have these products, e-cigarettes, which are certainly, on the most part, likely to be less harmful than cigarettes. Mm-hmm. And having them around may provide an option for those adult smokers who've tried everything and they haven't been able to quit, but maybe switching to e-cigarettes is a potential harm-reducing outcome for them. And so this makes it really interesting in terms of doing research that identifies the trade-offs, right? Mm-hmm. And what the FDA needs is an evidence base so that they can accumulate it and say, like, you know what, if we did this based on our calculations of population health impact, this will be good, right? This will be a net good for the whole population. So anyway, a very long-winded answer to kind of this overall research framework. And, some of the simple studies we did were merely just, what is the prevalence of use of certain flavored e-cigarettes amongst children in the United States? And so, I had the good fortune of being able to collaborate with the U.S. Monitoring the Future study and Dr. Richard Miek, who's a PI, for us to get together and, develop some survey questions to address it. So one of the simplest papers probably I've ever done, just percentages, right? But that was enough. That was enough. They're needed, even though that, like, people knew that flavors were, widely used, right? And there's anecdotes, and you see it on social media and some prevalence here and there. The definitive national estimates is what the FDA needs to make a regulation to say, hey, we have a strong enough evidence base. This is overwhelming, right? And so anyhow, so that led to some of the regulations that you mentioned, where flavored e-cigarettes are more difficult to obtain. And FDA is cracking down on illegally marketed flavored e-cigarettes. And kind of where we're going in the future with this work is trying to look at there are new types of e-cigarettes that may have the same flavor sensory profile as a strawberry, as a peppermint. However, they're marketed under an ambiguous name, and we call those in the field concept flavors. And so that's a real regulatory challenge. And so we're trying to identify techniques to identify those flavors that may be masquerading as true kind of fruit or candy type flavors. And then another area where we're moving into is there is a new sector of commercial nicotine products that are oral products. And so you may have seen these in gas stations behind the counter, but nicotine pouches, which have flavors and kind of youth-oriented marketing, which don't actually have tobacco leaves in them, but they're a little sachet, and they have microcrystalline powder, nicotine, and other additives. And, we're seeing initial evidence, and we provided some of that evidence actually here at USC, that this may be an up and coming product used by youth. And then the same thing for commercial nicotine gums that are flavored like pomegranate. So I'm not taking Nicorette, I'm not talking medicines, but these products, and also nicotine gummies, which we did some research on, and then the FDA did take those off the market after we published our study in pediatrics last year, led by Dr. Alyssa Harlow. So yeah, that's what we've been doing in that space and where we plan to go.
Interesting how you kind of close one loophole and then they just create another loophole to get through. But
Right.
Also just, I mean, not for a conversation today maybe, but as I think about the trade-offs that you have to make, as you were talking about earlier, ethics behind those decisions have been really interesting conversations. So because I mean, there are lots of ethical, considerations that would need to go into what do you do in this case. So anyway,
absolutely. Yeah, I mean, just because you brought it up, so it's really interesting. But we talked about like calculations of total lives. Would you upweight a life for a person who comes from a population who's historically disadvantaged, right, and have experienced inequities? Would a children's life, right, be weighted more? And so, yeah, those are some of the interesting ethical questions that kind of come into this. So I'm on the same page with you, Camilla.
Glad I'm not being asked. Those are some tough questions. But, I am going to actually ask you about something that's, near and dear to my heart. And that's just really the issues of how do we develop talents. And, when I look at your record, you've had trainees and mentees who have gone on to be awarded significant grants to further research in a number of areas. And you frequently publish with your mentees. So you're obviously very good at talent development. So what is your approach to talent development and mentoring the next generation of psychologists? And what do you find most rewarding about that work?
Sure. Yeah. Great question. Thank you. So I'm still learning on how to mentor. And so you learn new things, directly from your mentees. Also, I have some mentors out there too, who I refer to, who are senior to me. And so, I think first thing is you're always learning, right? So being too fixed, if you have some sort of a paradigm that you use, culture in the field and society is changing very fast. So certain practices and that may have been tried and true may not be as relevant anymore or as effective. So I think that's one thing that I've learned, is trying to kind of stay flexible. Also trying to, I think, also learn about the next generation and that kind of the cultural milieu, right, of someone who's born in the year 2000, right, and their experience of the world, which is different than mine, right, as a child of the 70s and 80s and 90s. So I think that's been very, very helpful too. And so it's always a learning experience. And then I think the other thing that's just been an incidental fun thing is, while I do mentor psychologists, I also get the opportunity to mentor non-psychologists, and that's always really fun. So I have an epidemiologist colleague, and it's really, really interesting for us to kind of talk shop and the way we think about data analysis and research questions. And it's been really illuminating for me to work with mentees who come from different backgrounds than psychology. it's the same thing within psychology. I'm a clinical psychologist. So, with you as a clinical psychologist, you're mentoring a social psychologist. It's the same kind of thing. It's you learn stuff, right, at that intersection. So, yeah, I think it's an ongoing learning process. And I think that, remembering that, just this is a relationship with the human being. And so, that's always important, is to you need to develop a relationship with the person, right? And that impacts the work, and their training. So, yeah, it's kind of a not a one size fits all. But yeah, maybe another conversation we can have offline is you can tell me what works for you as a very successful mentor and developer of talent over the years. So I'm always wanting to learn more.
Yeah, it's, I think, one of the most enjoyable and rewarding parts of our work is to see these talents blossom and bloom, and think that, maybe you just helped open a door that made that possible. And I just feel so good about that work when I can see young people, really flourish and making really important contributions that help humanity and society. But hey, that's going, that's going in a different direction. Let's go back to you.
Okay.
And actually, you touched on something in your answer that is a nice segue into the next topic that I wanted to explore.
Okay.
And and that is really digital media use and attention problems in teens. I mean, social media, it's just rampant, and we see. I mean, when we see teens today, you usually see them. At least when I look at my grandkids, what do I see? They have a phone and they're looking into their phone. I can just see the top of their heads because their faces are in their phones.
Sure.
And so, talk about this work. That as a whole, as TikTok and other highly stimulating media continue to grow in popularity, what can you share about your findings and where this area of study is heading? And is there, as I look at all this social media used by our teens, and I even see here on the college campuses where our undergraduates are walking to class, in pairs, but they're not talking to each other. They're looking at their phones.
Yep.
And I'm sitting here thinking, I'm a different generation, but I just can't help but think that there are some unintended consequences here that may not be good.
Yeah, I mean, you're right. You see like two people at a restaurant and they're both on their phones, right? But I have to say that, like, I'm a little guilty of this sometimes. And the phone is addictive. It just really is. I mean, it's like sometimes I can feel my motor impulse of like wanting to check something right on my phone.
I turned off my phone just to make sure.
Good for you. Yeah. I know. Right. But then it's like, you're like, why did I just open up my email? Huh? I guess it's like when you're standing in front of the fridge and you don't know why, but like, these are like very, food and digital media. These are really rewarding, potentially addictive activities. So, that's what got me into this. And I think that, I certainly wouldn't call myself a digital media use expert. I'm not like an attention, neuropsychologist, pediatric neuropsychologist type of an expert by any means. I just got interested in this because I'm really interested on kind of what are the problems facing today's youth and young adults. And so, there's been e-cigarettes, there's been cannabis, we've been interested in, teens' perception of society and discrimination in society and shifts there. So digital media is just another one of those. And we had a study in JAMA. It's very simple, just looking at the association between digital media use frequency and ADHD symptom occurrence. And, there was a small but significant public health significant, I should say, right? Association. So, we haven't taken that work that much further. Unfortunately, it's something that is a passion project, and something we'd love to do more of. I think that it's tough because it's not a classified addiction, right? And so funding agencies interested in addiction may not necessarily, want to focus on that, right? When we have a fentanyl crisis. And so, there could be mental health agencies, but, that are interested in this. But yeah, so I think because of that, it's been a little tough. And I think the regulation around social media is developing, but there's been talks about legislation about, what social media companies can and can't do for kids, the types of images and advertisements they're exposed to. There's been talks about scrolling limits, right? Because the never-ending scroll, whether it's Apple News or, TikTok, right? So to me, I think that's a really interesting area. And I hope that the field of psychology and other fields go deeper, because it's really has such a high potential, I think, for impact. Not everybody has a negative effect from social media, right? I mean, I think it's the same thing with marijuana use too. But I think that there's going to be a significant portion of people who are impacted, and kind of, even if the effect is subtle, because the exposure prevalence is so high and the exposure severity is so intense, we're talking hours and hours a day, every day, and the content gets more and more stimulating. And so even if there's this is a subtle effect that affects only certain populations with vulnerabilities, like the kind of population health significance of this problem, I think is critical. So yeah, it'd be great to see the field continue to push in that direction.
Well, and speaking a little bit about that, I'd like to probe that a little bit more, because
Sure.
I think as a dean, and other deans, and we're seeing our youth, and there's lots of articles that many of our youth are in crisis, and there's increase in terms of mental health problems. And what do you think? I mean, this is maybe not your exact area of research, but you're a psychologist. We're worried about our youth. Why is there an increase in anxiety, in depression, in suicide? What can we do about it? And, can social media perhaps lead to isolation or overwhelm people with all the problems that are going on in the world? Because we get bombarded with the crises every day. And if you're not, have they developed the maturity to deal with just one crisis after another? It's a little bit taking it off, but we're talking about addiction, and we're talking about addiction to social media. And what are some of the unintended consequences for our youth? And could that be part of the reason why we're seeing this uptick in mental health issues among our youth?
Yeah, I mean, I think this is one of the biggest, questions and problems facing, psychology as a field to address this. And, I think that the federal government has prioritized this, and President Biden, is really interested in not only curbing the addiction epidemic, but curbing this youth mental health crisis, right? And it's been steadying along for more than a decade now. And so this isn't just the pandemic, but the pandemic did not help, as we all know, didn't help any of us in terms of our mental health. And youth certainly were affected, but this was a trend that was happening, I think, going back to 2010. And so we did do one study looking at the role of social media to see if we could account for how much of the uptick U.S. youth who reported suicidal thoughts or behaviors. And we found like a small, but I think again, public health significant, estimate, right? Where we could say, I forget what the exact numbers are, right? Maybe it's like 30% of the increase may be associated, not causal, right? And so I think, we also have, and we've done research on this too, is concerns about police violence, right? That's another issue that's uptrending. I talked about, concerns about societal discrimination. Another aspect where we worked on was youth reporting concerns over school shootings. And so we're not asking them, oh, are you worried that a school shooting is going to happen in your school? Like some may be worried, some may not. But I think that the overall issue they're really concerned about and kind of what it means for public safety. And so this is kind of like a shared, I don't want to use the term trauma because that's not right, but a stressor, right? When we see these highly publicized events of people dying, or people experiencing wrongful death, right? Because of inequities. I mean, these things resonate with people. I think today's youth are worried about these issues. So there might be 5 or 6 or 7 or 8 that maybe coalesce to impact this. But, going back to your question, Camilla, and your example, like the loneliness, I mean, it's got to be a big part of it, right? The loneliness, the disconnectedness, I think also the ability to have a exogenous coping mechanism that you can just turn on. When you're at that age, it's really important to develop those emotion regulations skills that don't rely on exogenous tools. So I usually think of substances, right? But there's externalizing outbursts. It could be or sometimes it's kind of like, I'm upset, I'm closing the door, I'm going on my phone, and I'll see you tomorrow. A teenager talking to their parents. So anyhow, yeah, big issue.
It is a big issue. And, it heartens me to hear how engaged you are in all of this, because I mean, it is something that I worry about, and many other things are worrying about and seeing on their college campuses. And, they come to us after 18 years, and we're trying to help them transition into an adult life. But it's our youth, many of our youth, not all, but many of our youth are experiencing much more difficulty in that transition than anyone. But talking about that issue, and I mean, it's so clear that the work that you're doing has great societal impact, that if we could really draw on your findings, we might be able to develop better policies, better practices. And one of the things that you have done so well is the dissemination of your work and getting your work to influence policy and practice. And not all of us can do that. That's hard to do. It's not easy. It's not just sort of like, oh, I put my article out there, somebody read it, and all of a sudden now policy is better. Or all of a sudden somebody's going to implement this in practice. That whole translation part is so difficult to do well. And so why do you think that you've been so successful in ensuring that your findings have been, widely distributed or being taken up? I mean, you're obviously very, very good at the translation part, and that's a challenge for most of us in doing research. We want our work to influence policy and practice, but it's not a direct line, to our articles and our research to practice. So what has made you so successful? I'd like to hear that.
Oh, thanks. Yeah, right. So part of it is how do you do work, and after you do it, how does it get into the hands of stakeholders like policymakers, right? And then I think another aspect, and this is related too, is how does the general public access our work, right? Because they have a lot to learn from all sorts of different studies in psychology, sometimes just the knowledge, right, of a certain health effect, a certain new trend, maybe an underpinning of some sort of a social behavior or a cognitive process. Sometimes, just a little tidbit, the public learning about that, it affects them in a positive light, and they can incorporate it in their lives in some way or another. And I think that there's I think it's changing, but with some branches of academia, there's kind of like a inherent tension between our research methodologies, the way we present the methods, and the public, and they're being able to consume it, because we have gotten so talented in developing rigorous research methods that really, in some ways, they do more accurately answer certain research questions, right? And psychologists are so good at doing that, like designing experiments, or developing measures, or doing quantitative analyses that can kind of rule out biases, other aspects. But ultimately, what happens, I think, sometimes with these very advanced, highly rigorous approaches is that we're left with quantitative results, sometimes qualitative too, can be put into this example, that it can be very difficult for many psychologists sometimes to consume, the results if they don't have proper training, right? Of like, oh, well, this is a structural equation model, latent difference score. Not to call out folks who do that research, it's really important, right? But they see a beta weight, and some of our measures, the public or the policymakers, and like they don't know what a Cohen's d is. They don't, it's an effect size metric, right? But they know odds ratios, they know percentages. A Beck depression inventory score doesn't mean anything to some folks out there making these decisions, but it means a lot to us, right? And so I think a public health approach, or sometimes like a medical approach, is balances the rigor with also clarity and interpretable results, that a policymaker can say, hey, well, this, the percent in this group was 86, the percent in this group was 68. That's a difference of 14%, right? And then here's the odds ratio, or the risk ratio. They can kind of say, okay, well, it's X times more likely, or 12% higher, and they can kind of interpret that. And so using that latter approach in my research, just because of some of the journals and their preferences that are in medicine or public health, which is quite different than I think sometimes psychology, much shorter, to the point, 3,000 words, right? So I think it's interesting. And so those journals, they just tend to have, probably partly because of their prioritization of maybe more consumable results to non-scientists, and sometimes their reputation, right? Like the Journal of the American Medical Association, when you get a paper into those, they will publicize it, and then the public listens, right? And so I know we're doing more in psychology, and the American Psychologist is doing more of that. So that would be great, right? If there was just more consumable information in psychology that came out of our journal articles. And so sometimes that's really nice. Now, of course, there's alternate mechanisms too, like white papers and info briefs and other things. But you know, I think that's one of the key ways is, you know, designing studies that will result in kind of one or two sentences that you could just tell, you know, your friend who's a non-psychologist, non-scientist, say, oh, cool.
Yeah, yeah. And if we can tell the stories that, you know, that kind of illustrates the data, that's the best way to sometimes for people to comprehend sometimes are very, you know, maybe slightly difficult concepts to digest. But, you know, so we're talking about having impact,
Yeah.
you know, having our work having impact, and the ways that we can be intentional and thoughtful about ensuring that our work has impact. But you know what? Let's go back to that word, impact.
Yeah.
And what do we mean by that word, impact? You know, and that's, you know, the APF board spent a lot of time saying, we want to recognize people who have impact. And that's what the gold medals should be for, is to recognize individuals whose work has had impact. So I'd be kind of interested in hearing, when you think about having impact, how would you describe that? How would you define impact? And just interested in your perspective there.
Thanks. Yeah. I think that there's probably not one answer, right? So I can say in the way I view my current work, I would say, you know, how many people's lives can this work touch, right? So if it's something that changes the national policy, that is a, you know, that will affect population level prevalence of some sort of adverse outcome, right? And kind of going back to what I was saying before about, you know, the way FDA thinks about the population health standard and kind of the total number of lives, you know, that's a good one for me. And that's sometimes hard to quantify, right? And so, you know, usually historically you use citations.
Yeah.
And that's, you know, it's still, that definitely correlates with impact, right? Because it's the, you know, the more dissemination, I guess, and the more in terms of the work that gets disseminated changes people's lives for the better, that would be mine. Maybe the second one could just be just stuff that's really interesting, and that one's hard to quantify, right? But I think there's something also wonderful and impactful about the basic pursuit and discovery of knowledge. And that one's kind of like, yeah, that one's hard to operationalize, but you know it, right? Some of those classic experiments in psychology, you know, Stanley Milgram, right? Like, so you're like, wow, that's really, really interesting and really cool. And this is some sort of a fundamental process. And, you know, to those people, I think, I wish I could do that. Those are just really brilliant people. But yeah, I think that's another part of impact that's hard to strive for, but I think that many scientists want that. I just don't know how to do it.
Yeah. I hear you. There's just so many interesting things going on to ponder. But you know, we do have some questions from the audience. Right. But before we go there, is there something that, you know, is there a question that I didn't ask, but I should have asked? Or is there something that you'd like to add that we somehow didn't get to in our questions, but you think it would be really important to share before we go to the question from the audience?
Nothing in terms of topic of conversation. I do want to just take the chance before I forget, just to thank the American Psychological Foundation for honoring me. This is such a great honor, and it's so wonderful to be recognized for this. And so, yeah, big thanks to the trustees and the people involved. So yeah, that's really wonderful. So I really appreciate it.
Well, our thanks really goes out to you for conducting such impactful work that just really addresses really relevant questions today that are affecting our daily lives, and doing it with such rigor. And we were just so proud to have a psychologist among us who we could just be a poster child for how we can have impact in the world through psychology. So thank you for that. And, given that we are talking about all the breakthroughs that you have enabled through your work, what do you think might be the next breakthrough in addictions, vaping, or in any domain where a psychologist can make an impact? What is on the horizon here, that we can really say, wow, I didn't know this, and I'm so glad that we do, because now we can help humankind in a much more effective way.
Yeah, that's a great question. So yeah, I mean, there are several. I think, to speak kind of more to my personal research interests, I think cannabis. Cannabis is so complex. If you ask clinicians, they struggle with this because they have patients who use it medically, either with a medical, with a prescription or without, right? But we'll say that, they're using it for medical purposes. The literature is so inconclusive on many of these impacts. I think it's really hard, right? And I think it's really hard for not just psychologists, right, but physicians, primary care, public health professionals in terms of messaging, on harms. And I think that plus how the cannabis industry is commercializing at such a rapid rate, in tobacco control is a very good model, right? Because this is a highly evolving landscape and industry. And, there are issues of harm and harm reduction, as I was mentioning before. Some of these same things are at play with cannabis, but I think even there's just more heterogeneity and complexity in terms of the policies at a state and local level. So one potential more specific example is that the federal government has, I think in 2018, passed what's called the Farm Bill, and what it does is it defines what a hemp-derived cannabis product is. And so the difference between hemp and kind of the traditional cannabis plant that people use to get high, right? It's kind of a fuzzy definition, but what the difference is, right? But if you ask a botanist, but this outlines a specific quantification, and it's less than, I think it's 0.3% weight THC, tetrahydrocannabinol. Sorry, I'm a bad psychopharmacologist, but you know what I mean. And it's actually Delta 9 variant of THC, which is the one that's the main active ingredient that we've been studying for so long, right? And so in many states where recreational cannabis is not legal, or even medical cannabis is not legal, cannabis companies have created products that fit the definition of hemp-derived cannabis, but have enough psychoactive agents in it to get people high and potentially have some of the related health effects. And so the latest one we're seeing is THC Delta 8, a close variant of THC delta 9, which products can have high concentrations of that compound. That compound we're studying, but it looks like it has similar psychoactive effects. C9, a little different, but fairly similar. And so, if you just Google it, you'll find a bunch of news stories about Delta 8 products being sold, and I saw them I visited Dallas a couple of months ago, and I was like, why are all these cannabis dispensaries here? I don't get it. Like, there's not legal cannabis. I went in one, and it's like, hey, no, it's Delta 8. It's Delta 8, right? And so, this stuff is happening. And so I think, finding the evidence on hemp-derived cannabis products, these compounds, right, which psychopharmacologists are poised to do. I'll give a shout out to one of my divisions, Division 28 at APA, to identify, because there may be dozens of psychoactive compounds that are cannabinoids, but it's not just Delta 8. There's Delta 10 THC, there's HHC, and so on and so forth. So I think that psychology has a lot to offer, and public health, of course, too, to try to identify, like, what's the prevalence of these products, how widely are they marketed, what are their health effects, what is their addictive nature, so that the policymakers can start coming up with more loophole-proof ways to prevent unregulated commercial sales of an addictive drug.
That sounds so interesting, just like the vaping. We're back to that, isn't it? If there's a demand, they will figure a way, a loophole, and figure a way around it. So
that's right.
Well, we could obviously carry on this conversation for a very long time, but I think we have come to the end. So I just would like to say thank you for making time to speak with all of us here. It really has been an honor to learn more about you and to celebrate your commitment and impact to the field of psychology. So allow me to congratulate you once again on your well-deserved gold medal, and may your work continue and flourish. And I just cannot wait to hear more about your work and all the things that you're going to do in the future. You have obviously a very bright career ahead of you, and I will be following you. And I think a lot of the people here will also be following you, because clearly these are important issues. And before closing, let me just also thank our attendees for joining us today. This was our final Fireside Chat honoring the recipients of the 2022 APF Gold Medal Award. But you know what? The wonderful thing about psychology is that there are so many people doing great work that has impact, and we will have another cohort of gold medal awardees. And so stay tuned. We will start this all over again in 2023. And so there will be many more opportunities to learn about all the great work that is going on in psychology that is having impact. But again, thank you and congratulations. I have really enjoyed our conversation, and let me just say, I learned a lot. I'm going to go back. I'll be thinking about a lot of the things that you said now, because there were many new things here that I was not aware of. So thank you so much for joining us.
Sure, my pleasure. Thank you.
All right. Bye-bye, everybody.